I've seen a lot of headlines circulating recently asking whether a GLP-1 regime can boost fertility. And the framing of these articles makes it sound almost mysterious, like these drugs have some unexplained effect on getting pregnant. But it's not mysterious. It comes down to insulin resistance, and specifically a condition that used to be called PCOS and has now been renamed PMOS, polyendocrine metabolic ovarian syndrome. This name change is significant, and I want to explain why. Because it tells us everything about what's actually going on for the woman getting pregnant on these medications. Insulin resistance is a topic I cover a lot on my channel because it affects so many of us. Majority of the population, in fact. Although a lot of times it goes undiagnosed. And recently I've been talking a lot about GLP-1s and other peptides. Today I want to connect the dots, specifically for women dealing with PMOS and infertility. For decades, this condition was called polycystic ovarian syndrome, or PCOS for short, named after one of its most visible features, cysts on the ovaries. But that name was a bit misleading because the cysts aren't actually the cause of the condition. They're a downstream symptom. The renaming to PMOS reflects a more accurate understanding of what's actually happening. This isn't primarily an ovarian problem. It's a metabolic problem that shows up in the ovaries. The name change is a recognition that insulin resistance is the root driver for the vast majority of cases, not some isolated reproductive issue. And this matters because how you name a condition shapes how you treat it. If you think of it as an ovarian problem, you treat the ovaries. If you understand it as a metabolic problem, you treat the metabolism, and the ovarian symptoms resolve as a consequence. So to understand why women who previously struggled with infertility are getting pregnant on peptides, are getting pregnant on GLP-1s, we need to understand the relationship with high insulin. When insulin is chronically elevated, it does something specific to your ovaries. It stimulates them to produce more androgens, male hormones like testosterone. Insulin and a related hormone, insulin-like growth factor, directly stimulate ovarian cells to ramp up androgen production. And this is separate from anything happening with your actual reproductive hormones. It's insulin driving the process. But it doesn't stop there. High insulin also reduces a protein called sex hormone binding globulin, which normally binds up excess testosterone in your bloodstream. When this drops, more testosterone circulates freely. And this is why elevated testosterone is such a common finding in women with PMOS. Sorry, I'm still getting used to calling it PMOS instead of PCOS. It's not quite rolling off the tongue just yet. Elevated androgens then disrupt the normal hormonal signaling required for ovulation. The follicle that's supposed to mature and release an egg each cycle doesn't get the right signal at the right time. Instead of one follicle maturing and ovulating, you end up with multiple small follicles that start to develop but don't fully mature. And these are what show up on an ultrasound. Without regular ovulation, periods become irregular or absent. This is because ovulation is what triggers the hormonal cascade that leads to a period roughly 2 weeks later. No ovulation, no predictable cycle. And this, of course, makes getting pregnant significantly harder because there's no reliable window for conception. So the entire chain runs from high insulin to high androgens to disrupted ovulation to irregular periods and reduced fertility. Insulin resistance is the first domino. And this is exactly what is behind the headlines saying that women are getting pregnant on Ozempic. This is why women are getting pregnant unexpectedly on GLP-1 medications like Mounjaro and retatrutide. These medications improve insulin sensitivity directly. GLP-1 receptor agonists reduce circulating insulin levels and improve how effectively the insulin your body does produce actually works. When insulin drops, sensitivity improves. And the entire chain I just described starts to reverse. Once ovulation becomes regular again, periods become regular again. And pregnancy becomes possible in a way it wasn't before. So this isn't the medication directly causing you to get pregnant. It's the medication correcting the underlying metabolic dysfunction. Metabolic dysfunction that was preventing ovulation in the first place. And this is consistent with what's reported in the clinical literature too. Women with PMOS who lose even a modest amount of weight, in the range of 5 to 10% of body weight, frequently see ovulation and cycle regularity return. And GLP-1 medications are simply a more effective tool for achieving that metabolic improvement than diet and exercise alone for a lot of women. Now, before we go any further, there's an important note I want to make here about oral contraception. And this is really important to flag if you're not trying to get pregnant. GLP-1 medications can also reduce the effectiveness of certain birth controls, particularly because they slow gastric emptying significantly. If your stomach is emptying more slowly, the absorption timing and reliability of an oral contraceptive pill can be affected, which increases the risk of it not working as intended. So something to keep in mind if you're on the birth control pill. Now, before we wrap up, I really wanted to talk about whether or not GLP-1s, peptides are a band-aid fix or an actual solution. And I did cover this question directly in a previous video, talking about if GLP-1s were a cheat code for reversing insulin resistance. And the short answer is the same one that applies here. These medications are not bypassing the problem. They're addressing the actual root cause. For women who have been dealing with PMOS for years, who have tried diet and exercise, who feel like they're doing everything right and they're still not seeing improvements. And this is totally fair, by the way. The way to reverse PMOS might be simple, but that doesn't mean it's easy. Having a tool like this can be life-changing. A tool that directly improves insulin sensitivity is treating the actual mechanism, not masking a symptom. And this is the same point I've made in previous videos about retatrutide and food noise. And as we wrap up, I want to end on something that's really important to understand. PMOS is a condition that is reversible. It's not something you're stuck with for life. Yes, some women are more genetically predisposed to be insulin resistant, but diet and lifestyle turn those genes on. And that doesn't mean you're guaranteed to develop it or that it's something you can't get rid of. But yes, it can be really difficult if you're already diagnosed and if you're trying to reverse it. You can be eating the right foods, you can be exercising regularly, sleeping well, managing your stress, and still not seeing results. And if that's you, then yes, a GLP-1 might be a useful tool for you. But not everyone needs medication. That's not the point here. Make sure you have the fundamentals in place first. Make sure you're eating enough protein, make sure you're managing your insulin, you're not snacking, you're limiting processed food, you're eating enough fat. That is very, very important. You're sleeping enough, you're managing your stress. If all of that is in place and you're still struggling to get results or they're very, very slow, then maybe a GLP-1 might be for you. PCOS becoming PMOS reflects more accurate understanding that this is a metabolic condition, not primarily an ovarian one. High insulin is what drives PMOS. Lowering insulin, improving insulin sensitivity, that's what needs to be done in order to reverse it. If you focus on this, you're gonna lose the weight. Your hormones are gonna balance, and all the other symptoms you might be experiencing, they're going to improve. But a lot of people look at it backwards. They focus on losing weight, thinking that's the solution. But losing the excess weight is a side effect of lowering your insulin. Now, if you found this video helpful and you're curious about peptides and GLP-1s and whether or not they're right for you, I'm gonna link another video on the screen now. Thank you guys for watching, and I will see you in the next one. Bye.